A report by the University of Stellenbosch's Business School is calling for more investment in the early childhood development sector. Researchers say investment in expanding access to high-quality, age-appropriate early childhood care and education for nearly 4 million children under the age of 6 could create more than 450,000 jobs for women. Currently, only 40% of children under 6 in South Africa have access to early childhood education. For more on this, we can speak to Laura Brooks. She's one of the contributors to the University of Stellenbosch Business School's 2021 Women's Report. Laura, good to speak to you on this Women's Day. Grateful for your time. From reading your report, it comes across as though we're still not taking early childhood development seriously in this country. Is that right?
I would say that's right. I think there's clear signs that government prioritizes early childhood development on paper. It is an apex priority of government. It's prioritized in various pieces of legislation, including the National Development Plan. And yet, why is it that we're not yet seeing resources flowing and an enabling environment created to promote this crucial part of our society's structure to enable both our economy to function and our human capital to grow?
And just on that point, one of the things I was mentioning in the lead up to our conversation is how you're saying if there were to be more investment in early childhood development, we could see possibly the creation of up to 450,000 jobs. And most of the people we know in this country who work in early childhood development are women.
That's right. So that's 450,000 new jobs that we could be providing and ensuring are providing real livelihoods for women in a sector that is really ripe for growth. And those are just the direct jobs. What we also say in the report is that because early childhood care and education programs provide a place for children to be during the day, and their care often falls on women in households if they don't have access to affordable programs for children. And so the indirect effect of ensuring people have access to these programs is also that additional women would be able to go and look for jobs and participate in the workforce who might otherwise be burdened with the care of their children.
And it's an alarming number when you think of only 40% of children in this country, 6 and younger, have access to early childhood development. You wonder about the long-term effects, how they will fare, for example, when they go into primary school education.
That's exactly right. So, I mean, the key issue with not having access to a program, particularly in the last 2 years before one would enter grade R, is that you are not empowered and enabled to participate on the same level as those children who have had that opportunity. And it's really an investment in the foundation of human capital for children's education and growth later in life. And essentially, by not ensuring children have access to these opportunities, we are undermining their ability to reach their full potential later in life.
And the pandemic's impact then on early childhood development and women who we know in some cases as primary caregivers have had to either quit jobs or scale down on hours spent at work to care for children as a result of nursery schools and creches closing?
Yes, we did see the enforced closure of early childhood care and education programs and a prolonged enforcement of that, which was there was a court ruling which stated that the Department of Social Development had to release programs and allow them to operate again to support the reopening of the economy and the provision of care and education for young children. But because of that prolonged closure, many programs suffered with the absence of fee income and with the absence of their subsidies for that period. And many people had to shut down their programs for good and to find other work in other sectors. We did also see on the positive side the resilience of the sector. However, when slowly they've been able to manage to comply with the protocols to reopen, we are starting to see programs starting to reopen and children starting to return. But what's not clear is what the impact has been on the quality of the services provided. And that is a concern.
And Laura, moving early childhood development out of basic education to social development has been somewhat controversial in South Africa. From your research, has it proven to have been a detrimental move to the sector, the children, and especially women guardians?
We're still awaiting the actual implementation of the move from social development to basic education, which has been gazetted to happen on the 1st of April next year. But we in the sector are seeing it as a massive opportunity for us to reimagine what the regulation and support to the early childhood development sector could look like. In particular, a focus on the legislation which governs the provision of programs, where we are asking for government to look at what we have in South Africa and the circumstances in which private providers, who are essentially 99% of providers in this country, are not government services. They are private providers who are providing services in their communities. And we're asking government to say, let's celebrate that, let's support that, let's help those programs to meet the standards that we foresee for our children, and have those standards be a progressive bar that we're working towards, rather than a punitive and exclusionary bar, which means that the majority of programs aren't eligible for support and subsidies, which we are in dire need of that in South Africa.
Laura Brooks, worrying observations from your research, but good to speak to you on this Women's Day. Thank you.